Thank you. I was saying that it's quite interesting the way you put it, comparing the sensitivity of both tests, which is now developed canine testing and the PCR testing. I haven't read the study, paper itself, but it has a clear scientific basis. We know that canines have a highly developed sense of smell. And if you can identify that the COVID-19 virus or disease itself causes patients to emit a certain odor, I think dogs are the best animals to be able to identify it. And at 94% sensitivity, it's going to be a game changer in public places, in airports. It may actually enhance screening, because the turnaround time for a PCR test as compared to the time it would take for a dog to simply sniff and maybe give a nod to say this one has got it, this one hasn't. So it's going to be a game changer. It's quite interesting. I found the news rather surprising as well. But I think COVID has been with us only about 18 months, so we'll keep discovering new things about it and better ways to approach it as well.
After all, it's the novel coronavirus. And just to add, I mean, it's not been peer-reviewed entirely. But let's talk about safety now. I mean, earlier on, the WHO says at least 115,000 healthcare workers have died from COVID-19 since the onset of the pandemic. Now, this has raised questions about the frontliners. I mean, you expect that our frontliners should be well protected. So, over a year after COVID-19, do you feel safe enough now, especially when attending to patients at the ICU? How do you feel?
Well, from my own personal experience, I feel really safe. I mean, we've survived now, say 3 waves, and the second wave was significantly at a higher peak than the first wave. In the UK, when we go back into March, April, that's essentially this time last year, there was a significant number of healthcare professionals who unfortunately we lost to this pandemic. However, when you go into the second wave and third wave and you compare, you realize that this was not the case. And I think the difference was the PPE, which is the personal protective equipment, which were not available at the start of the pandemic. I think as time went on, manufacturers were able to upscale their production and able to meet with the logistic challenges of delivering to frontline. So I think that's what's significantly changed. Unfortunately, a lot of people have died. A lot of health workers are still dying in other countries, for instance. But in the UK, I think the significant change was the provision of PPE when it was needed and to the people on the front line where they needed it.
So 3 lockdowns, 3 waves. There are plans to open up finally June the 21st. Do you think that people can handle a 4th lockdown if maybe plans to lift the restrictions by June the 21st are derailed?
Well, I hope it definitely won't come to a 4th lockdown. I think no one would want that. As to whether people would handle it or whether they can handle it, I think that over the last 18 months, we've seen a significant shift in public orientation all over the world, not just the UK. The difference is that at the beginning, there were so many skeptics, so many people doubting the existence of the virus to begin with. And as a journalist yourself, you notice that all those skeptics have sort of died down. There's widespread public enlightenment now about the dangers of COVID. Everybody wears masks outside. In addition, there's been vaccination, which has been highly successful in the UK. Vaccination has been open in the last few days, people less than 35 years of age. When you put all that together, it seems very likely that even if we're going to have a lockdown in the future, it will be more on a regional basis, maybe on a county, on a sort of local council basis, rather than all over the country. Because I think now, with the effective track and trace systems that have been put in place, what we expect to have is that when it's noticed that there's a trend of a rise in the incidence of a particular strain, as is going in some parts of the UK now about the Indian variant, I think that what's going to happen is that that area may have a sort of mini lockdown of its own. But I don't think, given our achievements over the last year or so, that we will go into a nationwide lockdown ever again. However, I think the people are much more enlightened and educated. If it has come to that, I think we will cope with it.
Well, Dr. Deji Olale, thank you so much for your time.
You're welcome.